mental health exists on a spectrum, okay? And even though, you know, in the DSM-5, which is the Bible in a way that the doctors, psychiatric doctors use to diagnose mental illness, even though they classify mental disorders into very discrete categories with the best knowledge that we have, we find as well that actually mental health is not binary. It's not either you got an illness or you don't, right? It's not black or white. It's either you have it or you don't, right? It actually exists on a spectrum. So what some experts are moving into is the idea that mental health exists like this. You are healthy, okay, or you are thriving. Some people use thriving, so you're growing, you're experiencing positive emotions, you're good, right? Healthy. Reacting is sort of like when you're on an average sort of level, you know, you have some stresses, you're reacting to the stresses, but you're doing okay, right? And then injured is when you start to have some symptoms of mental illness that may or may not fulfill criteria for an actual disorder, right? So that's when it starts. And then when you're ill, when you're basically at rock bottom, right? When your function is completely affected by this. So we're starting to think of mental health on this sort of spectrum where any one of you can move up and down this spectrum at different stages in your life. Okay? So why is this important to you as a healthcare professional, right? Let's look at this. So this is a little bit of what I mentioned earlier, what the mental health spectrum is like. And this is what we are moving into, okay? The idea that you can move backward and forward between healthy, reacting, injured, and ill. Now, if you look at injured and ill, these are the ones where there's some functional impairment starting, okay? So you can see some of the symptoms in healthy and reacting would be part of normal life, part of everyday life, and it happens to us at different seasons in our life, okay? But then if it starts to cross into being injured and ill, and if you look at the symptoms for being injured and ill, right, it may sound quite common, actually, some of it, right? Feeling worthless or feeling hopeless, having anxiety, some sadness that lingers, you know, difficulty with sleep, some reduced performance at our workplace, that kind of fits us at some point, right? Does that mean we are mentally ill, or does that mean that there are some periods of time where we need more support, right? So these are, you may move back and forth at any point. Okay, so mental health is not just like you're crazy or you're not. Okay, you're taking medication or you're not. You have a diagnosis of schizophrenia or you don't, right? Sometimes there is an overlap. And sometimes for depression and anxiety especially, we shift back and forth on this spectrum. Okay, so that's another picture of the idea of the mental health spectrum. And what the researchers have found is the percentage of the population that sort of like go through it, right? And you'll find that the percentage of us who are completely mentally healthy, i.e. flourishing, right, in the yellow portion of the graph, is really not that much. In fact, the majority of us are at reacting, right? So at moderate sort of mental health. Yeah, so it is at any point of life, really, we could move into languishing and we could move into mental health disorder, right? It's really more common and more possible than you realize, right? So that's one part of it. Another part of it is how psychiatrists are beginning to look at things. There's something that is called dimensional psychiatry. So the idea that symptoms can overlap, right? If you look at this, okay, this is how they've sort of like graded some of the illnesses and how the symptoms overlap. So look at where you can have cognitive impairment, right? Negative symptoms, meaning low mood and things like that, can occur actually across the board. It can occur in schizophrenia. In fact, I would extend this negative symptoms part further to the bipolar and unipolar mood disorder as well. You can have those symptoms, right? So it doesn't mean that, I mean, there is an overlap as well in the symptoms that lead to a that are part of different psychiatric illnesses. Okay, so I mean, the whole point of introducing this to you today is the idea that everything exists on a spectrum in mental health, right? And we want you to have that awareness that I, at any moment, could slide back and forth on the spectrum, and I need to be aware of when I should be seeking help. Okay, because it is really more common than we think about, right? So when we think about mental health issues versus a mental health disorder, okay, the definition of a disorder at the point at which you should seek help is actually functional impairment. Okay, so the DSM-5 will repeat itself again and again. And you may see this in later lectures, okay, that the symptoms cause clinically significant distress or impairment in your social life, in your work, and in other important areas of functioning. So relationships, home life, things like that. Okay, and your hobbies, you know, your other responsibilities. Okay, so why is this important? I'm putting this out here as a 1133. Okay, so if you think about it, the current stats show that 1 in 5 people will experience a depressive episode in their lifetime. So whether that this depressive episode extends to a long battle with major depressive disorder or whether it's a one-off thing, but 1 in 5 of us will experience a depressive episode. So if you think about the people who are in this room, we are thinking about 1 in 5, 1 in 5 people, that's super common, right? If there's 60 people, 12 people will have it, okay? 1 in 20 people suffer from depression globally. So that's 5% of the population. That means in this group, we may be looking at what, 3, 4, 5 people, or maybe more. These are just the current estimates based on whether people seek help or not, right? And if you think about it, in lower to middle income countries, according to the WHO, we are not a high income country. We are middle to upper middle, I think. 3 or 4 people receive no treatment for their mental illness. And another one is depression and mental disorders in general are leading cause of a global burden of disability. So when you think about disabling conditions, right? We think about, we seldom think about depression, but it is one of the top 3 in the charts. It's right up there together with lower back pain and heart problems. If you think about the people you know in your life, how many people have lower back pain and how many people have cardiac problems, the number of people who have depression is likely to be equal, right? So again, the idea, why is it important to me as a healthcare professional? I just want to say that nobody is immune, right? That you at any point could develop some kind of mental health disorder or some kind of mental health issue. And it is important for you to have that awareness that, it exists on a spectrum. If you are going through a rough patch and you're in the injured and ill category, it doesn't mean you'll be there forever, but maybe it means that you need to seek help, right? So that's sort of like the idea that I want us to have, that the patient that you see who is struggling with mental illness is really not so far away from you. Yeah, that on the spectrum, he's just a little bit on a different spot. At any point, you guys could switch and you guys could move up and down, right? So I'll pass the time to Mac, actually, to Mr. Maclean, to just share his experience as a service user.
Right.
Over to you, Mac.
Hi. Okay, Amanda, I really like the word cloud just now because I can seriously identify with the words in the word cloud, because that was the understanding I had when I looked at mental health and I couldn't differentiate between mental health and insanity, so to speak. So words like stress, gila, frozen, crazy, and all these things, depressed, these are for me what the general public has in mind when you ask them about mental health or psychiatry. It was all the same thing to me back in the day. Insanity and mental health, it was the same thing. If you were depressed, oh, that guy has a problem. But like all things come around to you. So when I was myself diagnosed with major depression in 2017, I started to put an understanding into what I was going through, right? And aside from going to seek psychiatric help at the psychiatric clinic in GH, I started asking experts, what were the things that I was going through? How can I put a word to it? Because there's, you have to kind of like cut out the hearsay from the facts. So I think the more you learn, the more you are aware of what you're going through, you can work at it. You can, all that. So this led to me volunteering for Mental Health Association of Sarawak, getting involved in their activities and all that, and learning through interacting with them, what I was going through. And it is very true what you said. It is a spectrum. You start off feeling healthy, and all that, and you shift up and down this particular spectrum. And I ventured off into the orange and red zone, so to speak, where my anxiety and depression actually impeded my work, and I was unable to perform. And the stresses, it was like work stress, personal stress, family stress. When everything comes to a head, comes at you at once, you reach a point in your life where you just break and you're unable to cope, and you just the word I can put on is you just stop functioning. You just stop, you just kind of like caught in this limbo, and you're stop functioning. Nothing works. That's what I went through, and I went through that spectrum. And apa ubat tidur, yes, it's true. I was given sedatives to sleep because I could not sleep. I developed insomnia. And I was put on medication, antidepressants for 3 years. I was on antidepressants, and while going through this process of you know making myself better, getting better, I still had to work and perform at my job. That's a responsibility I had to my employers, right? So to me, if I were to have one thing to say to mental health professionals in the field, is take the time to understand what it is, in actuality. If possible, sit down with people who are actually going through that process of recovering. I'm not a sufferer, I'm a survivor. So that's how I look at myself now. I've survived this period, that particular spectrum. I've come back down to within the green zone or the yellow zone in that stage, right? But at any time in my life, and I'm very aware of it, I can actually go back up the spectrum again. I can hit a bad patch. I don't know, in the future, and I could easily move back into that red zone where I would need to ask for professional help. you know so that particular spectrum is a reality, and it's very, very real for people like me who step out and ask for help. There's a lot more people who never took that step forward to ask for professional help. So they remain injured, they remain ill, right? They're in that stage, and they never come out and say, I need help. No, and they just stay in that position, and they get labeled all sorts of words by society, you know, all that. So I, to me, it's very important for professionals to understand that this is very real. This is reality in itself. That before we give a label to something, at least take the time to understand what is being labeled. Just step out there, take that time. There is still a human being on the other side of that label who's probably going through a really bad patch in their life, right? And they may not have had the courage to step out and say, yes, I'm injured. Yes, I'm ill. I need help. They may not have had that. And it could be mental health professionals themselves giving this particular individual the courage to step out and say, I'm injured and I'm ill. And also to say, look, we can help you too. We can help you get this professional care that you need, because you kind of moved into this end of the spectrum. So to me, as a person, what you mentioned about, as mental health as a spectrum and all that, is so real. It's real. It's not just merely academics. But if you sit down with someone suffering, they will actually tell you this is quite real. Some days you wake up, you feel healthy. Some days you wake up, you feel very ill. And that's the reality for people like me. We had to learn to regulate our emotions, regulate even how we think. I'm very regulated when it comes to how much sleep I get, because that's the key to my particular condition. If I don't get enough sleep, I get stressed, and then I get anxious, and that snowballs into depression and overthinking, and every other health issue comes along after that, right? So we are in that position. This is the spectrum that we live in, and for the rest of our lives, once we understand what it is. So I can't emphasize how true this is, that mental health is a spectrum. It is. And yeah, Amanda, that's what I have to say about this.
Thanks, Mr. Maclean. Thank you. Yeah, so you hear it. So you know that I'm not just going on about some abstract concept. You hear it from Mr. Maclean, who has struggled through this before, that it really is a spectrum and really nobody is immune, right? We can move up and down the scale at any point in our life. So let's look a little bit when Mr. Maclean mentioned, seeking help. Let's look at what the different roles of, common, when we talk about seeking help, there are a few common healthcare providers that people mention, right? So let's think about what are the different roles. Okay, so you will hear this being mentioned quite a few times, and sometimes people use all this interchangeably. There's counselors, there's clinical psychologists, and then there's psychiatrists like myself. So what are the differences between them, and in what situation should one see each of these people? Okay, so a counselor basically has a qualification in counseling, and then sometimes they have a master's in counseling as well, right? If I recall right, in Malaysia, to do counseling, you need a master's further. So they provide you with support for specific issues. So if there's specific life changes, specific tough times you're going through, they provide a listening ear and they provide support. They may help with some problem solving and things like that, right? So they're usually providing support for specific issues, right? And for some people, counselors may be an initial preferred point of contact, a non-threatening point of contact, okay? Because sometimes people think that clinical psychologists can read people's minds and psychiatrists only want to prescribe you medication. So they prefer to go and see a counselor first as an initial point of contact. So school counselors, university counselors, even workplace counselors, sometimes these are the first port of call for people to seek help. Okay, so that's the role of counselors. Clinical psychologists have a qualification in psychology plus clinical psychology as well. All right, so they are credentialed to perform very specific assessments like IQ assessments, certain psychological tests. They are the ones credentialed to do it. That means that all the IQ tests that we do online are quite different, right, from the one that is administered by a credentialed clinical psychologist. Okay, so that is the role. And they also do specific psychological therapies for specific conditions. So in depression, for example, the psychological therapy that has a really strong evidence base is cognitive behavioral therapy, or CBT. And these are done by credentialed clinical psychologists. All right. So these are usually when you need certain specific psychological therapies for certain conditions, whether they are more simple conditions or more complex conditions, we go to a clinical psychologist. Okay. Now, psychiatrists are doctors who deal with mental health. Okay, so they have a qualification in medicine and then they specialize further in psychiatry and mental health. They can prescribe medications, okay, and psychiatrists have differing levels of experience in psychological therapies. So some psychiatrists do a lot of psychological therapy, and they get credentialed and they get more experience in this, so they do more. Some psychiatrists do less. So generally speaking, a lot of people go to psychiatrists for medication. And then in some cases, they go to them for psychological therapies as well. All right. Okay. Any questions regarding that, by the way? If you have any questions, please feel free to post it up, yeah? Yeah. Or if you're wondering, you know, if your question is, what is the ideal place to seek help? Honestly, in government settings, clinical psychologists need to be seen by, you need to see a doctor first before you see a clinical psychologist, okay? But in a private setting, you can go straight to a clinical psychologist. So you can seek any of these for help. What normally I decide based on the need of the person. Yeah, so some people need to see a counselor, some people need to see a clinical psychologist, some need psychiatrists. So it kind of depends on individual. I usually match the need based on what I know. Yeah, but you can seek help with any of these professionals. Okay. Oh, yeah. So at what point, someone has asked, at what point to seek help? Should we seek at a tiny bit of dysfunction or not feeling okay? Or once you're just, you know, at what point should we seek help? You know, overseas, people go to therapists just to talk, right? Just to talk about their problems. And sort of like while they're still in the green or yellow zone, before it gets like to the orange and red zone, they go earlier. This is kind of what we try to encourage locally, that we can seek help earlier to talk about our problems, right? And sometimes when we talk about our problems and we get other perspectives, we prevent ourselves from heading further down the spectrum. However, this is not something that has caught on a lot locally. People are a bit worried about going to see mental health professionals for fear of being labeled gila, right? So in our setting, people are still usually seeking help when they have reached a certain level of dysfunction. So it's affecting their lives, affecting, or sometimes there's a huge crisis. It's become a huge crisis already, and then they come and seek help. So in our setting, people generally seek help in that manner. But I would say if there is no point that it's too early to seek help, you can actually seek help earlier if you feel the need to do so. Yeah, but at the point at which it's compulsory to seek help, I would recommend when it starts affecting function. So when you're starting to sort of like cross a little bit into a disorder, an anxiety disorder, depressive disorder, things like that. When you're starting to cross a little, I would suggest seeking help. Then you definitely should. Anything before that, you can opt to. And I think it's a good idea, actually, seeking help early. Yeah. All right. So pharmacists, right? Since we are, we are in a pharmacy workshop, I wanted to specifically address pharmacists. Okay. What could your role actually be? Maybe you won't be dealing with psychological therapy for patients. You won't actually be prescribing the medications, although you can actually discuss with doctors their choice of medication, and you can actually give input. I'm very happy for pharmacists to give me input regarding medication if they think that there is a medication that's better, right? But what could your role be? Perhaps in your day-to-day encounter with patients over the counter, when you encounter them in the psychiatric ward, right? Perhaps your role can be to be very human about it. Now that you're aware of the mental health spectrum, that you couldn't be very far from the patient, maybe your role is to consider where you are in your own mental health and to be human to a fellow human being, right? To be kind and to be compassionate, to have a little bit of understanding, like Mr. Maclean mentioned earlier, right? Seeking help earlier, seeking understanding earlier, actually, seeking understanding, sitting and talking with people who do have a mental illness and trying to understand, right? One thing you could do is to actually remain mindful that you are dealing with other human beings and not just somebody to give the medication to. Just bagi-bagi only, clear you away from the counter faster. Although I know, in some places it's very busy and you have to do that. It's important to just remember that you are dealing with other human beings. Maybe your role can be to think about the impact, both positive and negative, of the medication for this person that's in front of you, right? To think about whether they've been explained to, the medication has been explained to them or not, whether they have concerns about it, right? So to at least be aware, to think about the impact of this. And maybe your role is also to encourage people to persist in their journey, right? It doesn't take long. I'm not expecting you to do a full counseling session at your counter pharmacy, but maybe it doesn't take a long time to just be kind and just to encourage them, that this is mental health struggles are becoming more common nowadays. It's and you're doing good. You are a survivor, like Mr. Maclean mentioned earlier. You're a survivor. You can keep going, right? So maybe your role in that little short period of 2 to 3 minutes can be to encourage people to persist in their journey. So you do have a role. Actually, wherever you're working at in the pharmacy settings, you do have a role, right? So practically speaking, how can I be helpful to the person in front of me is a question I would like you guys to sort of like think about in your daily practice. And I'll give the time over to Mr. Maclean again.
It's a very good question, Amanda, because I can answer it this way. How can I be helpful to the person in front of me? It's the kind of help I would want to be offered if I was in that situation. That's how helpful I can be. If I was put in the shoes of the person surviving this episode in their life, therefore, you can basically know the kind of help they need. And I mean, to be fair, my experience with healthcare professionals, have been overall very good. The one that actually prompted me to see a psychiatrist was actually a doctor friend of mine who's actually a cardiologist. So, he's a very close friend of mine. And he looked at me one day and said, you're not the person I'm so used to being with. Is there something wrong? And that was when I told him, yeah, I don't feel well. I'm not sleeping well. I've lost weight. In 2 weeks, I've lost about 10 kgs. I'm not eating well and all that. And he looked at me and he said, do you want me to recommend you to see a psychiatrist? And I said, that was when I said yes. So then I had a little caveat. I said, if you recommend me to see a psychiatrist, I don't want to see the ones in UNIMAS because I know all of them. They're all my friends, right? So that's why I opted to go to the psychiatric clinic in GH. And my experience there is, it's like the psychiatric clinic really is a busy place. It's a busy place. In my 3 years of attending my sessions there, I saw 4 different psychiatrists, because there's just so much work to be done and so many patients seeing them that we get whoever's free at that moment, they would take up your case. That's kind of how it is in a psychiatric clinic. And my experience, they are just the nicest of people. The psychiatrists, they are the nicest of people. They would listen. My first session was just 1 hour plus. I think one and a half hours of me just talking, and this poor young psychiatrist just listening to me talk. And that's all it takes. Just to sit down and to know that someone cares enough to listen to what I have to say. As ridiculous as it sounds, at least they're listening, right? So if you were to ask me how to be helpful, I think one of the first things is to listen, to Secondly, is to look out for the signs. Now, if you see your family members or your close friends or even your patient behaving in a way that is not familiar to you, it's okay to just ask them, are you okay? Are you feeling well? Are you feeling well? And kind of like start a conversation, because if they are able to start talking about it, then you just listen to what they have to say. Okay. So my experience with professionals so far has been pleasant. I have not been turned away by any professional in the field, probably because they kind of like understand the field that they are in. And these are psychiatric professionals. The other thing I just want to make it clear to healthcare professionals is that you cannot treat people in a cookie cut manner. You cannot just go through a checklist. Oh, because this is what we learned in school. There's a checklist of how this patient is. They show this, yes, therefore they're this. No, every individual is different. We react differently. We behave differently. And for me, when it came to medication, I had to change my antidepressants. Like, I think it was 3 to 4 months in my first prescription. I had to change it because it wasn't working for me. You see, so I had to tell my psychiatrist that this medication is not working for me. I'm actually getting worse. So they changed it. They put me on a different medication, and that worked. You see, so sometimes things like this happen. There's no cookie cut approach you can take dealing with a mental health patient, right? You have to treat them as a human being, and you have to really be sensitive to how they react to all this, to the process that they're going. And the biggest role you can play, especially as pharmacists, is just be a coach. Help us get along. I had friends who react to antidepressants in a way where they stop taking the medication because they say they don't like the way they feel when they take the medication. You see, that I don't blame them. That's the only way they can express themselves, right? You can bombard them with as much facts about the medication as possible, but to them, they will tell you, but I don't feel right. So it just takes another human being to empathize with, to show empathy to that process that they're going through, and then to tell them, it's okay, it's going to get better. It's going to get better. You just have to stick to the program. It's going to get better. you know and just stick by them, check up on them. Are you taking your medication, and so on and so forth. I had the psychiatrist. I was off antidepressants on the 4th of March 2020. On the 18th, we went into PKP. You imagine that. My anxiety levels peak. And but the psychiatric clinic called me up and asked me, how are you doing? We know you're off your medication. Are you if at any time you feel you need help, call this number. you know they knew that there's going to be a little bit of a kickback for me getting off my medication. But thank God that up till then I have learned other ways to manage myself, not just with medication. And all of these things I learned through my therapy sessions, to talking to mental health professionals, to my interactions with those who are very knowledgeable in the field. So I've learned ways to manage myself. So imagine that the little bit of information you can share with survivors to encourage them through their journey, it pays off in a big way. The moment they get off medication, they would need to have other tools to to help them along. And that's probably where pharmacists can help, counselors can help, and so on and so forth, you see. So I just want to, to all of you pharmacists out there, the the kindest words, even if it's just one word that you can give to us, to a survivor, goes a long, long way. Even if you just tell them, if you feel like you need to talk to someone, I'm here. I'm here at this counter. You can always pop in, and we can have a chat. You know, you never know. You could have stopped someone from hurting themselves. You could have stopped someone from quitting the program. You never know. For us as survivors, we just want to know that there's somebody out there who understands what we are going through, right? And who will be there to kind of like coach us as we go along that line, Trust me, once you are diagnosed with a condition, mental health condition, it becomes a very lonely journey because a lot of people do not understand what you are going through, right? So how can I be helpful to the person in front of me? Think of what would be helpful to you if you were a survivor, right? Okay, Amanda.
Thanks, Mac. Really, really powerful sharing. In that sense, I hope that it's helpful to you guys to hear from Mr. Maclean, as a service user, as somebody who's encountered multiple pharmacies at the counter, right? What would be helpful? Okay, how you can be helpful in little ways. Yeah, we're not expecting you to become psychiatry experts overnight, but how you can be helpful in just little ways. Yeah, so it's really interesting to note that a cardiologist was who first recommended Mr. Maclean to seek help. And that sort of like points to the point that actually any one of us can, learn to identify when someone is in distress and try and encourage them to seek help. So you in your role, both as a person and as a pharmacist, can do that as well, right? It doesn't have to be specifically a psychiatric doctor who does, who identifies someone who needs help. You can actually do it as well. And it's, a really good point about not seeing UNIMAS psychiatrists or not seeing, it's true. In fact, I don't recommend that students see UNIMAS psychiatrists per se as well, because there's a conflict of interest, especially if the student is going to be assessed by me in the posting in a medical program, for example. Yeah, so this is also something just to put out there, that there is such a thing as conflict of interest. And if you know the person personally, you shouldn't be their therapist. Yeah. The person who, like me, if I am assessing students in psychiatry, as part of their education, I shouldn't be the treating psychiatrist as well. That's just a side point. Yeah. Great. Okay, so I think it's really, really good that Mr. Maclean brought up the pandemic, right? In fact, it's had a massive impact on global mental health. Okay, we've been seeing in this article in the Lancet, they've been seeing, cases rising very sharply, and they've identified actually the cases of mental disorders, right? Specifically, additional cases due to COVID-19. So if you look at that, in the dark green and dark blue on the graph on the left, you'll find that there's quite a significant addition of cases due to COVID-19. So we are talking about what? Another additional 25% maybe of cases, right? 25% addition for depression, right? And we are talking about easily almost another 25% for anxiety disorders. Okay, so we are really seeing it peak, and it does seem that it affects the ladies more than the men, which also brings forward a point that sometimes in psychiatry or mental health across the board, it takes a lot for men to come forward. Right, so we really appreciate advocates like Mac who come and speak to us about this, because it takes a lot for men to come forward, and it is generally known that men seek help later. All right. In fact, women are, I mean, according to the statistics, women attempt suicide more, but the men are more successful. So on the record, men may attempt less, but they are successful once they decide to do it. Okay, it's probably related to the fact that they seek help later as well. So we find that the cases are on the increase due to the pandemic. Okay, and healthcare workers are not spared. All right, so so this study sort of like did a survey of frontline workers, healthcare workers, and we find that many people, the majority of healthcare workers report stress, anxiety, frustration, exhaustion, being overwhelmed. Right? If you look at the percentage on the left, it's really, really quite a bit. All right. And I think that's applicable to the people, the healthcare system that we see around us as well, the healthcare workers around us as well. All right. And if you look at this as well, the symptoms that people have reported during the pandemic, emotional exhaustion is an all-time high, trouble with sleep as well, physical exhaustion is another thing, of course, work-related dread, right? Dreading going to work. We find that there's an increase as well. Okay, so so we can look at this on the spectrum. We can say that during the pandemic, a lot of people have moved to the orange and the red of the spectrum. Okay, so exactly the case in point that given the right circumstances at any point in life, we could slide up and down. Okay, in the spectrum, and we need to recognize when we should seek help. Okay, so just another poll. You can go back to menti.com and type in 2212-2955 again. Okay, it is the same. It is the same QR code and the same number. All right. Let me see. Hang on. Move to the next slide. Okay. Yeah. So, oops. Okay, if anyone still needs the QR code and the number. Okay, if you can take your time to rate the statements. I have a whole bunch of statements there. I'd like you to rate how much you agree or disagree with each of them. Again, your responses are anonymous, so you can be honest about it, and we would want to see what you think. Yeah? Okay. Let's have a look and see. Keep going. 2212-2955, yeah? All right, so if you look at this poll, it's a Likert scale, yeah, of 1 to 5. What do I think of the following statements? We find that the highest agreement is that mental illness is preventable, 3.7. That's probably good if you are looking at it from a point of view of seeking help earlier, which is what we've been talking about, right? Mental health on the spectrum, learning to seek help earlier. It is true to some extent that mental illness is preventable. But then there are a few exceptions though. We have to remember also that mental illness is like a cake. You don't bake a cake with one ingredient. You bake a cake with a few ingredients, right? There's flour, there's eggs, there's chocolate powder, there's butter, right? Sugar, okay? So there are some mental illness that to some extent can't be prevented because of a combination of factors, okay? A combination of life circumstances, a combination of genetics, a combination of medical illnesses that influence the brain, right? So there are some mental illnesses that are not completely preventable, okay? But the severity can be reduced if help is sought earlier. Of course, there are also some mental illnesses that are preventable if you seek treatment earlier and you don't sort of like go and hit rock bottom. That's possible as well. Okay, so there are a few possibilities for this now. Yeah. Let's look at the bottom one. Mental illness is destined to be a lifelong struggle. The majority of people, little over half of you agree that the level of the agreement is quite high that this is destined to be a lifelong struggle. Yeah, perhaps Mr. Maclean will be able to sort of like give us some thoughts on the matter after that. In this, in terms of being a lifelong struggle, yeah. Again, it depends on the individual. It depends on life circumstances as well. All right, mental illness is hereditary. Okay, you're getting a scale of 3 here. Okay, mental illness, yes, to some extent there is a genetic component, but not entirely so. It's just one of the factors. Like if you're making a cake, mental illness could be like the flour. Okay, so some cakes have flour, some cakes don't. Some cakes you can make without flour, right? So mental illness can exist even without the presence of the genetic component, although the risk may be higher. Okay. All right. Anxiety and depression are more minor mental illnesses compared to schizophrenia and bipolar disorder. Not necessarily true, right? And you haven't really agreed with that, right? Anxiety and depression can be severe as well and can be as disabling. Schizophrenia and bipolar disorder, if treatment is sought earlier and medications are started earlier, sometimes the cause is much better than anxiety and depression where help is not sought. So it's not necessarily more minor. Okay, if you are on medication, it means your mental illness is more severe, also not necessarily so. Okay, being on medication may just mean that you sought help sooner, or you have certain predispositions that make you a more suitable candidate for medication compared to some other people. So, like Mr. Maclean mentioned, it's not a cookie cutter thing. It's individual on an individual basis. And even the choice of whether to see a counselor, psychologist, or psychiatrist is on a case-by-case basis, really. So again, this points to the fact that we're talking about being human, that everybody is human. And being humans, there's variety. You are made up of different things than I am, right? Okay. Asking about suicide increases suicide risk. I'm glad that there's not much agreement for this, right? In fact, talking about suicide is a good thing, right? In fact, if you don't talk about it, the person was already thinking about it in the first place, right? And many people, many people think that you increase risk, but you don't necessarily do so. The research indicates that it doesn't. Yeah. Okay. Thank you for your participation, guys. I will bring us back to the slides. Okay. So I'd like to talk a little bit about self-stigma today. Yeah. I mean, all of us have heard about societal stigma in mental illness and how it affects recovery. Okay. So prejudice, basically negative attitudes, and discrimination, negative responses, meaning I don't want to deal with this person, no, leads to stigma. All right. Yeah. So here's how self-stigma works. All right. I want you to meet this man called Corrigan and his progressive model of self-stigma. Okay. Let me see. Let me draw your attention to the middle part. Okay, it's a bit beyond the scope of this talk to be talking about all the other parts, but let me draw your attention to this part. Stereotype awareness, stereotype agreement, and self-concurrence. Okay, this is how self-stigma happens. Okay, number one, you have a stereotype awareness, meaning you are aware of the cultural stereotypes around you regarding mental illness. Yeah, so that means that remember when we had the word cloud earlier? One moment, can you actually hear me clearly still? Because they're running some vacuum cleaner outside. Can you still hear me clearly?
Yeah, we can.
Okay, great, great. Okay. Now, this is how it happens. stereotype awareness, first you are aware of the cultural stereotypes regarding mental illness. So remember the word cloud? There's the word gila, there's the word psycho, there's the word schizo, attention seeking, manja, right? These stereotypes, you become aware of them. That's stereotype awareness. This leads to stereotype agreement, where you are not diagnosed with any illness yet, but you agree. You internalize the cultural stereotype. So you say, you agree. People with mental illness are dangerous, incompetent, violent, unpredictable, which was a big word in our word cloud earlier, right? They are somehow to blame for their illness, must be too weak, must be because of their life decisions, must be because they took alcohol and drugs, we blame, right? People with mental illness are cursed somehow, or unsuccessful or hopeless, right? So we take on board these things. We internalize them and we agree with them. Oh yeah, he must be a problem. He must be a problem. We agree. Then, when you develop a mental illness yourself, you apply those internally agreed stereotypes to myself. So I think he's incompetent. That guy who has mental illness is incompetent and unpredictable, dangerous. And then I apply that to myself. Now I'm unpredictable. I'm hopeless. I'm unsuccessful. I am to blame for my mental illness. We internalize, we agree with the stereotype, and then we self-concur. So we apply all these stereotypes that we agree about in society to ourselves when we develop mental illness. Okay, so as a result of this, there are two diverging outcomes. Okay, there are two effects on the self-esteem and self-efficacy. One is a positive effect. Some people go like, there's stigma, but I'm going to fight this. So they go all out, like overachieve almost. They go all out and they fight it. That's in a way a positive impact on the self-esteem and self-efficacy. All right, or they go all out. The other outcome is a negative outcome on self-esteem and self-efficacy. So it goes down, okay? And that's the fourth stage of this model of self-stigma that Corrigan talks about, which is harm to self. So that's the thing. And your self-esteem goes down, your self-efficacy goes down, and then you develop these behaviors from that. You say, okay, you know what? I don't have any, I feel so low. I feel not myself. I am, so unsuccessful and so hopeless. I don't want to meet my friends. Very malu. I don't know what to say. It's too anxiety provoking to meet with them. I have no interest in meeting with them. Who would want to meet up with me? These are the things that go on. And then you behave by limiting your social contact. When you limit your social contact, these behaviors will then reinforce again the reduced self-esteem and self-efficacy. So it becomes a vicious cycle. And it all starts with self-stigma. Okay? So that's how it works. So when you think about this flowchart and you think about how this model works, then perhaps if today you learn to protect others from stigma, meaning you don't internalize the cultural stereotypes, you don't accept number two, you don't do stereotype agreement, you don't internalize, you don't agree with the cultural stereotypes about mental illness, perhaps one day you will be protecting yourself from self-stigma if you should develop mental illness. Right? So, that's the thought that I want to leave with you. If you understand how self-stigma works when you develop mental illness, then perhaps a way to protect yourself from self-stigma is really to not agree with the cultural stereotype. So stop at stage number one, be aware of the stereotypes in your society, and stop there. Don't internalize the cultural stereotype, learn to go against it, and perhaps one day if and when you do develop mental illness yourself, and this is very common, right? 1 in 5 of us at least will develop a depressive episode in our lifetime, then we won't apply that cultural stereotype to ourselves. And we won't subject ourselves to our own self-stigma. All right? So I pass the time to Mac as well.
I do agree with Amanda on this. That's the whole point I'm here today. to talk about mental health and my own experience about it, and just to break that stigma, just to tell people, look, this is what it is. This is me being honest about what I had to go through, and this is me fighting the stigma, so to speak. I am. Um, it's funny how, even though I have been diagnosed with this particular condition, I've gone through the program, I've survived it, and I'm in the process of living life with it, because it is something that is with me. I'm very aware of that. I like that point about lifelong struggle. I'm very aware. It's a 50-50 thing. It's a 50-50 thing. I can't say I don't have it, because I do. What happens is, I'm aware it's there. I've learned to not allow it to inhibit me from living the best of my life. you know and you talk about stress. Try being head of corporate communications. Try to be head of corporate communications for a university. You talk about stress, right? But this is my responsibility, this is my job. And I manage myself, and I've learned to live with the conditions I am. I've learned to accept it as being me. This is who I am, and this is the package that comes, for existing on this planet, so to speak, in this world. So this whole thing about stigma is that, yes, community stigma is always going to be there. We are always pointing out the oddballs in the community, right? But the most important thing to me is, how do you view yourself when you are in that community? You can either go, like that divergence. You either can go positive or you can go negative. you know Most of the time, I've encountered people who gone slightly on the negative side of things. you know and my role would have been to kind of like step in there and say, look, there is another option. There is another option. You can thrive, you can live the best of your life within with your condition. You just need to take some baby steps in a positive direction. First and foremost, you need to accept the fact that, yes, this is what I am living with, right? Mental health issues, there are medication, there is treatment out there. you know you're not It's not like an end all game. There are options that you can choose for yourself in order to that. I like what someone said here. The courage to be disliked. Bro, in life, nobody's gonna like us. Your mother may like you, right? But I can't say for maybe another 99 people, right? There is going to be someone who will dislike you. That's just the way life is. So yes, the courage to be disliked. If you can stand out there and just be yourself, I say that's courage. If you're there out there to tell people, this is who I am, these are my weaknesses, these are my strengths, this is me, then yes, you have the courage to be who you are. So for me, stigma here is, I do agree. If you want to break the stigma, have more conversations about it. We need to have more people talking about mental health, to tell people, to tell the general public that, yes, anyone can get this, but there are treatments, there are professionals out there who would listen to you, who would understand, right? And this is something that is, survivable. There's one thing I like to say about the PKP, the MCO, right? I felt like, finally, everybody feels anxiety the way I feel anxiety, right? I'm no longer alone, right? Now everyone is anxious. Now everyone's going, feeling a bit of depression,
Yeah.
because that's exactly what we
Yeah.
go through in our normal life, right? And for a period of a time during the MCO, I empathize with everybody. I know how it feels to be anxious. I know how it feels to be depressed. You know, finally, we feel like we're not alone. So talk about stigma, right? Just when everybody suddenly realize they are inflicted with this condition, stigma just went out the window, right? You can't you can't stigmatize another person for the condition they're going through because everybody felt it. You see, so that's uh, how weak stigmatization is actually. The moment it is normalized, the moment you talk about it and everybody agrees, oh yeah, it's like this, the power of stigma just diminishes, right? The power of stigma just goes away. And so that's stigmatization. And trust me, I've had people say that, oh, dia makan ubat gila, when they know that I'm taking antidepressants, or dia tak pandai buat kerja, dia tak boleh multitasking. I've heard it all. Dia tak perform, so tak tahu macam mana nak handle dia. I've heard it all. So you live with it because you can't blame them because that's what they learned. So you do really need to have that courage to take that positive route and just to take it in, and yourself best. You know that you taken the steps to to get professional help. You know that you're going through the program and you're getting better. You know yourself best, right? And that there uh um that there is that courage. Yes, the courage to be disliked. You're not doing it for clout. The courage comes because sometimes you just have to be courageous, if you want to live the best of your life. So yeah, I mean, that's all I have to say about stigma. I mean, the moment everybody gets it, stigma goes out the window, so to speak. Right? That's the easiest way to combat stigma. Just make sure everybody learns about it. Just make sure everybody knows about it, and tiba-tiba, well, people just stop looking at it in a weird way, right? It's like
Yeah.
just normalize it, So
Yeah.
yeah.
Yeah. Oh, great, great. Thanks, Meg. So inspiring actually. Yeah, so inspiring. Thanks. There are I hope that you guys have sort of like an idea of what we're trying to put forward to you today. That it's really not it's really not beyond any of us to develop a mental illness, but the good news is that there is help available, right? And you actually, as pharmacists, have a really important role to sort of like Meg mentioned, to be a life coach in a way, in a little way, to people, to be encouraging and to be kind to people
um
during the
yeah. Yeah,
journey.
Amanda, there's this question here,
Oh yeah,
what
I
would
check
be
out a few.
what would be your advice on how to help someone when you discovered a
Mm,
person is having suicidal thoughts or attempting suicide? As in,
yeah,
like, what can we do to help? Now, um, try to start a conversation. Um,
great,
you know, ask them, what can you do to help?
agreed.
You don't tell them what to do. You just ask them, what can you do to help?
Mm,
I remember how this guy in, I think it was Bangladesh or somewhere, who was suicidal. He was and all that. What they did was they just gave him a cow because that was what he needed most. He needed, with that cow, he was able to plow his field and get back to work again. That type of thing. It could be as simple as that. Ask them, if you have that conversation with them, try to spend that time to really look at what do they really need help with. Most of the time, there's a cry for help, and people fail to provide that help.
Yeah.
So for those who are attempting suicide, don't tell them, you're not there to tell them what's right or wrong. You're there to just listen and provide that help where possible, and I think that's the best that you can do. The fact that you already know that this person has these thoughts or are attempting this means that you are now in a position to provide a measure of help to this person, and the worst thing to say is snap out of it. You get, that to me, like, wow, that's the worst. Sometimes the best thing, it could be just sitting quietly with them and just allowing them that time to just talk. That could be all they need. So really, it's just being human, and it's just understanding that this is a human being who just needs help, and you're there to provide this help. So that my 2 cents about this,
Yeah, completely agree with Mac. I think another important thing you can do is actually to offer to seek help together.
Yeah.
Sometimes people respond to that, like just being able to I'll accompany you. Do you want to go? And sometimes people respond to that. Yeah. Great, thanks, Mike. We have a few questions. Clinical psychologists at the moment in KKM are only available in Kuching and Miri, if I recall right. Hopefully other places upcoming. It's relatively new. We only had our first one in Kuching SGH in 2018. So they are continuing to increase the places. So at the moment, still Kuching and Miri, hopefully more soon. So not all places have it. I think someone also asked about how can a pharmacy specialize in psychiatry and how we can get there. I think Laura, if you can eventually, I wouldn't know in detail, but I'll get Laura to get back to you about that. Help-seeking behavior will be covered in subsequent sessions, so that's great. There are 2 questions here which we'll go through quickly. Fatin asks, what do you think about how people, simply claim they have a psychiatric disorder, or they throw the terms around, right, in a way to joke about the stigma? Okay, I think we need to. That is the reason why the awareness of what it takes to diagnose a disorder is super important, because it affects function, right? And that's why in psychiatry, psychiatrists don't very quickly diagnose somebody with a disorder. It needs to have a significant impact on function. If you have OC traits, obsessive compulsive traits, you may have obsessive compulsive personality instead of disorder. And personality is really there's a lot of variation, I can have anxious personality, I can have obsessive compulsive personality, but it doesn't entirely get in the way of my life, then we don't diagnose it as a disorder. Okay, so I would say it can be hurtful to see this being thrown around, especially if you really struggle with OCD, right? Somebody with severe OCD has to live alone. We know of that, because nobody can live with them with the amount of time that they are spending checking and cleaning. Nobody can live with them. It's a really lonely disease, so it's hardly something to joke about. Hopefully, eventually, we joke less about it. Or maybe if we want to, we can start to learn the difference between obsessive-compulsive personality and obsessive-compulsive disorder. In fact, these are 2 very differing degrees of, 2 very differing conditions. And one is not even a condition, one is just part of your personality, right? So 2 very different things. Hopefully we can move away from that. Yeah, I hope that answers your question, I think.
Yeah, I would just tell this person, that's not nice. That's not nice, it's not nice to joke about it, because what if you do encounter someone who really does have it? And I think it's just belittling that person and what they have to go through in life, So I would be quick to point out to people that that's just not being very nice. And if you really want a firm diagnosis, then go to a proper professional and get yourself diagnosed. If you really rather than simply saying it off your head, get a proper diagnosis. Get a psychiatric card in a psychiatry clinic. So that they will definitely tell you what you have. So just don't make a joke about it. I mean, it's not nice. It's not nice.
Yeah, and that's a really good point. Seeking help. Please remember, you can actually say to this person that even the psychiatrists and clinical psychologists will not assess and diagnose you without your permission. By right, it has to be like, people think that, clinical psychologists can read your mind. You talk to them and they can analyze everything you say and come up with some like mind reading funny witch doctor thing. But no, in fact, a clinical psychologist needs to have your permission to analyze what you're telling them. So psychoanalysis is something that needs permission. So in fact, coming to a psychiatric interview with a psychiatrist, most of the time it's either with your permission or circumstances, like, it's become a crisis, like a huge public safety crisis or something, when the psychiatrist has to come in without your permission. Okay. But most of the time, assessments for psychiatry will need your permission. In fact, if a psychiatrist somebody referred you to the psychiatrist in the ward and the psychiatrist came to see you and you refuse to see the psychiatrist, we can't actually just step in unless there is a clear evidence of harm to yourself or other people. Okay, so just bring that up with them.
I mean, there's another thing I also like for people who like to joke about these conditions. You know how hard at times it is to live with the condition, because, for example, for myself, I had to jump through a lot of hoops just to get a life insurance. Just to get life insurance, because the moment they hear or find out that you do have a diagnosed mental health condition, it's a whole lot of paperwork to do. You have to dig out the medical records, like you have to prove to there's a lot of other stuff that comes along with, so you don't just simply say, oh yeah, I have OCD, for those of us who do have this and who are diagnosed with some measure of mental health issues, there's a lot of other stuff that we have to live with, because of what we have, So it's really not something to joke about, because I get sensitive, because I would tell them, oh boy, then you probably have a hard time getting insurance if you have OCD. You think about it, health insurance and all that, you're gonna have a hard time, but it's seriously not something to joke about, right? So
so it's not something to joke about, and it's something that's actually assessed with permission, right? With consent usually, right? So second question here as well, how can a psychiatrist identify a true psychiatric patient, as some of the patients might hide their real feelings during consultation, as they might be forced by their family to see a psychiatrist? Really good point. There are a few strategies we employ. Okay, first thing first is to bear in mind that sometimes psychiatric diagnosis changes over time. We may not get a full diagnosis at the first visit. In fact, given the nature of mental health issues and how disclosing your innermost thoughts and feelings can be intensely painful and can be really traumatizing, psychiatrists are used to not getting all the information in the first setting. So usually, psychiatrists and clinical psychologists, mental health professionals in general, see patients over a period of time, and you get a better picture of what you're dealing with over time. Okay, so it's not really like you can go and test for COVID in one sitting and you get a positive or a negative, that kind of thing. It's something that you gain over time. You identify what the patient actually deals with, or what condition they have. If they have any mental health condition, you obtain it over time. That's one thing. The other thing is there are some measures that we use during the psychiatric interview to build rapport and to build trust. Nobody is going to disclose it to us, because it's so private, right? Mental health issues and all your struggles and all your drama with the people around you. It's such a private thing. So we usually do our best to build a rapport and to ensure privacy. Sometimes we see the patient on their own without their family. We learn to look at the things that the patient is telling us as well as the things that they are not telling us, right? What their facial expression tells us, what their movements tell us, what their behavior tells us. It's not intended to make you feel afraid, like we are reading everything about you. It's not but it's more like we want to know. We learn to observe these things so we can help you so we can be helpful, yeah, and we can sort of like get an idea of what you want to tell us, but you feel like you can't, right? So it takes experience. I think so the psychiatrist identifies a patient. They are used to patients not disclosing everything in one setting. So they have learned ways to build a rapport, to build trust, to create a conducive environment, and to sort of like try to deduce what you are telling us. Active listening, listening and reflecting back and trying to see if there's anything you really want to tell us but you can't or you're afraid to tell. So these are skills that so we don't just learn how to prescribe medications, we do learn quite a number of these things as well. And that, of course, that is perfected over time. Okay, I think we do not have actual time for others as well. Somebody asked, I have a few direct message questions, but I probably will address those privately. Yeah. Okay.
Yep. All right.
I'll hand the time. Thanks, Mac.
Thanks.
Thank you, Laura. Thank you.
All right. Thanks, guys.
Thanks, everyone.
Have fun.